So Rand Paul is the sometimes libertarian, sometimes not Republican senator in Congress. And he's often looked at as the more rational of the Republicans. And sometimes he is. But when it comes to healthcare, he sounds just as ridiculous as the rest of them. So this is what he said on MSNBC's Morning Joe.
Senator, sort of a threshold question here. Do you favor the government providing an avenue to every American to have affordable and accessible health care?
I accept the goal that everybody should get health care and it should be at a less expensive cost. I don't think the government does a very good job at distributing anything. Look at, the Soviet Union distributing bread. When the government gets in charge, look at the current post office trying to deliver letters. The government's just not very good at things.
Okay, I have to stop the video there because the examples that Rand Paul uses, the Soviets distributing bread and the post office distributing letters, those are the arguments he's using against public-funded healthcare. I mean, if he were to make an actual argument, he could say, well, most people hate Medicare. Medicare doesn't work for people, and that's why universal coverage wouldn't work. But that's not the case, because people love Medicare. In fact, in a 2015 Gallup poll, people were asked what their satisfaction level was with the US healthcare system. And interestingly enough, the top 3, military and veterans, Medicare, and Medicaid, are all government funded. So in practice, government-funded healthcare actually has higher satisfaction rates than private insurance. I mean, the comparison to the Soviet government distributing bread is just absolutely ridiculous. A better comparison, other than the Medicare comparison, would be, I don't know, Canada giving healthcare to everybody, or Britain giving healthcare to everybody, or Sweden, or Switzerland. I mean, these are actual real-world comparisons where the government is distributing healthcare to people, and it works. And as I showed you, it doesn't just work in those countries, it also works in America. So now let's get to the next part of this clip.
But do I want everybody to have insurance at a low cost? Yes. The main problem we have in our health insurance market is in the individual market. If you work for Toyota, you work for General Motors or Ford, you're pretty well protected. If your spouse gets sick, you don't lose your insurance, you don't lose your job, your rates don't go up. I want everybody in America to have group insurance. So everybody in that individual market, I would let them join an association. And my hope is that the vast majority, if not all, of the people flee the individual market and you no longer have it. Everybody in the individual market, you should be able to join the Restaurant Association, the Retailers Association, the Chamber, the NFIB. All kinds of associations could be buyers and purchasers of insurance, and we would defeat the problem of adverse selection by getting people the hell out of the individual market.
All right, Senator Rand Paul, we thank you for coming on. Greatly appreciate it.
Okay, so there are a few points to hit on in this clip. First off, Rand Paul asked himself the question out loud. Do I want everyone to have insurance at a lower cost? Yes. Yeah, I would think so. Yes, of course you're going to say yes to that question. No, I want no one to have insurance and at a higher cost. Yeah, obviously you're going to say that you want everyone to have insurance at a lower cost. That kind of goes without saying. It's how do you get there? What is your plan? And I have a plan that I'll get to, but let's get to more of Rand Paul's ridiculous points. So, group insurance. So his big argument is you should have the choice to pick whatever insurance you want, no matter what group. So you can pick the retail association and be part of their insurance group, and that way there's more competition and there's more, it's group insurance. So because it's group insurance, the cost is lowered and blah, blah, blah. You know what the biggest group would be? The American people. What if everyone paid into an insurance system? That way the cost is spread out among everybody because they're all paying in. Now, how would you implement something like that? What exactly would you do for that to happen? Maybe, I don't know, what if you get rid of healthcare premiums so you're no longer paying private health insurance and instead you pay a small tax and that's what pays for your healthcare. And you don't have to worry about plans or comparing insurance companies or pre-existing conditions or whatever. You pay a little more in taxes. you don't pay a healthcare premium at all, and you have health insurance, group health insurance, American people health insurance. Doesn't that seem like the ultimate solution? But no, Rand Paul still seems to think that private insurance companies have your best interests at heart, and they don't care about their profit margin at all. They don't want to keep raising profits. Premiums aren't going to keep growing because companies naturally want to keep making more and more profit. No, not at all. They care about you. Really? This is why the majority of other countries, or every country that's gone to a universal system, stays with it. Because it works. Nobody is out there screaming for private insurance companies to come and save them. And is there a private option in many of these countries? Yes. But there is a universal healthcare system. So you don't have to go to private insurance. Because you realize when everyone pays in, there is that net, that safety net for everybody. So when you're feeling sick, you don't have to wait for it to get worse and worse, or get to the point where it's deadly. You can actually feel okay about going early and not having to pay anybody to go and see the doctor. Because it's covered. It's automatically covered. You don't have to worry about insurance. You don't have to worry if you have it or not. It's automatically covered. And that is the ultimate group insurance. Now, I'm not the only person that thinks this is a great idea. Because, well, as a Canadian, I have it. But also, Americans think this is the way to go. So in a Pew Research poll in January of this year, they asked, is it the responsibility of the federal government to make sure that all Americans have healthcare coverage? And 60% of people said yes. It's the government's responsibility that everybody have healthcare coverage. And the other point in this video that I want to hit on is just how Rand Paul went completely unchallenged. Really, maybe it was because it was the end of the hour and they had to move on. But this is the problem with this stuff. These politicians and the media here, they're all buddies. They're all friends. And they'll be challenged sometimes, and they'll be asked a question that they're used to being asked. And they'll have their typical response for it. This is the problem with the mainstream media. They want access to these politicians, so they can't challenge them too much. They challenge them just enough so that you think that they're actually being challenged when they're not. And if these politicians were truly principled and believed in what they were saying, it would be no problem to be challenged. Being asked hard questions would be fine, because you would have the knowledge base, the principles, and the facts to back up whatever it is that you're trying to sell. But half these politicians are just completely full of shit. And that's why you'll never actually see them be properly challenged and be able to defend their ideas. Hey folks, so the YouTube ad money for shows that question the status quo is abysmal. So if you want to help me out, consider throwing me a few bucks on Patreon. Go to patreon.com/therationalnational. There is a link below the video and somewhere on the screen right about now.